When looking at Medicare supplements in 2024, there's really only two options that make sense and that are comprehensive and popular going into 2024, and those two are Plan G and Plan N. Before we get into both of them and break them down on the whiteboard to see what they really cover, all I ask is that you would please subscribe and like this video. We're growing really fast here on YouTube, and that goes a long way of helping me reach more people just like you. That being said, there are a few things that you're going to want to know before we look at these two different Medicare supplement plans. The first thing is that all these different Medicare supplement plans were made to make that other 20% that original Medicare doesn't cover more affordable for you. So this is your red, white, and blue Medicare card. You'll get this before you turn 65, and this is what they call original Medicare. So you can see that it says Part A and Part B. Those two together cover you at 80% of anything that you get done hospital or medical related, leaving you with 20% out of your own pocket that you have to pay for. That's where these supplement plans like Plan G or Plan N come in and make it more affordable. Now that you know that, it's also important to know a couple things that are going to be the same no matter what company or plan that you choose. The first thing is that all these supplement plans are what they call non-network plans. So they don't restrict where you can go to get medical help. So you can go to any doctor, any hospital in the country as long as they accept Medicare. Another important thing to know about all these supplement plans is that you don't have to receive prior authorization to go to any specialist. So there are no referrals needed on any of these supplement plans. One other important thing to know before we get into it is that the benefits with all these different plans don't change from company to company. So say that you were looking at a Medicare Supplement Plan G with United Healthcare, it's going to be the exact same coverage as a Medicare Supplement Plan G with Aetna. All these companies can't decide what their Plan G covers. All they can do is decide how much they charge for them. Now that you know that, let's take a look at the whiteboard and see what Plan G and Plan N actually cover. Now let's first take a look at Medicare Supplement Plan G, because I believe it's the most cut and dry and easy to understand. So like we said before, the Plan G is going to cover that 20% gap that Part A and Part B comes with. If you take out a Medicare Supplement Plan G, you can typically expect a premium of $120 to $200 a month, depending on where you live. In some places across the country, they may be $120, or they may even go up to almost $300 a month. So it's important to look at the prices in your specific area. With Plan G, you can also expect no copays. It's going to pay that 20% in full. The only thing that you will have to pay on top of your premium is a one-time a year, January through December, $240 deductible. But once you pay your premium and that deductible, you have 100% coverage no matter what. I always like to use this example. Say you got diagnosed with cancer and you had $1 million worth of cancer bills. If you had a Plan G and you paid your premium and that deductible, you wouldn't pay anything else for the whole year. With Plan G, you can also expect to not have any doctor networks. All Medicare supplement plans are what they call non-network plans. So you don't need a referral to go to any specialist. It's between you and your doctor. It's also important to know that about 92% of all doctors and hospitals accept Medicare Supplement. So you won't have any trouble finding a doctor. Medicare Supplement Plan G is not going to cover anything on prescription drugs. So if you take a Plan G out, you're going to have to go out and get a separate prescription drug plan to cover your medications, which typically costs between $10 and $15 more per month. The last thing I want to highlight about Medicare Supplement Plan G is that they don't cover any extra benefits. So you won't have any dental, hearing, or vision coverage. But if you guys are interested in that, you can go out and get a separate plan to cover those services. As you guys can see, Plan G is a very comprehensive, and you can see why it's so popular going into 2024. Now let's take a look at Plan N. That's the second most popular supplement plan going into 2024. If you take out a Medicare Supplement Plan N, it's going to be very similar to a Plan G, but there are a few differences that you're going to want to know. If you take out a Plan N, the premium is typically between $80 to $200 a month, again, depending on where you live. I've seen some as low as $70 or some as high as $300 per month. This is where Plan N differs from Plan G. There are going to be a few copays that you're responsible for. So say that you go to your primary care physician or you go to your doctor's office, it's going to cost you a $20 copay. Or if you go to the emergency room, you're going to have a $50 copay. And then just like the Medicare Supplement Plan G, you're also going to be responsible for that Part B deductible, which is $240 going into 2024. Plan N is just like Plan G. You're not going to have any doctor networks. So as long as you go to a doctor that accepts Medicare assignment, then you're going to be 100% covered. So even on Plan N, you're not going to have any trouble finding a doctor that takes it. Also with Plan N, they don't include drug coverage. So again, you have to go out and get a separate prescription drug plan to have your medications covered, which is about $10 to $15 more per month. Plan N is also not going to cover any extra benefits, just like the Plan G. So you're going to have to go out and get a separate plan to have those services covered. The last difference that I want to go over with Plan N is that it doesn't cover the 15% excess charge. So say that you go to a specialist and they don't accept Medicare assignment, or in other words, they don't take Medicare's payment in full, you may be responsible for some extra costs. So for example, say your specialist visit was $400. Well, your original Medicare, Part A and Part B, are going to pay 80% of that. So they're going to pay $320 of that bill for you. And then, assuming that you met your deductible for the year, the Plan N is going to pay the other $80. But since that specialist doesn't accept Medicare assignment, you could be responsible for 15% of that $400 bill, which would cause you to be out $60 for that visit. In conclusion, if I was getting onto Medicare tomorrow and I had to choose, I'd take Medicare Supplement Plan G over Plan N. And I'd even take it over Plan F if that was even available. But let me know in the comment section below, do you agree with me? Would you take Plan G over Plan N or Plan F? Let me know in the comment section below. Also let me know if you have a different opinion. Would you take Plan F? What would you choose? Let me know in the comment section below. Thank you so much for watching. Don't forget to subscribe, and I'll see you in the next video.